Gentlelady from the Virgin Islands, Ms. Christensen.
Thank you, Madam Chair. As we prepare to take this momentous step to reform the healthcare system in this country, it's a bittersweet moment for me and my fellow delegates who represent the offshore areas of the United States. It's sweet, of course, because due to your hard work and the dedication of Chairman Waxman, Chairman Dingell, Chairman Pallone, and that of our House leadership and our President, many others, quality health care, including prevention services, will finally be accessible to the tens of millions of Americans who today are uninsured. But the bitter pill for me and the others is that as of today, despite the funding provided, which we do appreciate, the territories will not be afforded the same access in Medicaid, Medicare, and the exchange. It is my hope that we can still continue to work to rectify this inequity for the 4.5 million Americans who love this country and faithfully serve it. And on behalf of the Puerto Ricans, Virgin Islands, Guamanians, Samoans, and Northern Marianans who have given their lives on all of our behalf. America's Affordable Health Choices Act presents a bold and important step forward, and there's much to applaud in this bill. My other colleagues have spoken of many of them, but I would like to focus on those of which are of particular importance to people of color who continue to experience severe health disparities and premature preventable deaths every day. In that regard, I applaud the efforts to not only expand but to diversify the health workforce, to improve data collection, to provide translation services, to include the territories in the federal poverty level study, to expand community health centers, and the attention paid to community-centric prevention efforts. We're also pleased with the expansion of the National Health Service Corps and loan repayment programs, the fix for the doctor's Medicare reimbursement rate, and the efforts to strengthen Medicaid and Medicare, which will incentivize providers, especially those who dedicate their lives to providing care in our nation's most underserved communities. At the very outset of this process, the CBC and the entire Tri-Caucus made it clear that health disparity elimination needs to be integrated throughout the bill. And while much has been accomplished, there are still areas that we need to improve upon. Among these are strengthening the anti-discrimination language, restoring coverage to ex-offenders, elevating the National Center on Minority and Health Disparity Research to an institute, improving the CER provisions, and including dental in the basic package for adults, as well as improving the treatment of the territories. We continue to stress the importance of including language requiring racial and ethnic diversity on all of the councils, committees, commissions, and task forces created or referenced in the bill. If diverse voices and points of view are not at the decision or policy-making table, history has shown that the concerns of every American will not receive due consideration. Finally, I feel we are falling short of the best bill we could have by not using the savings that all of us know will be realized from the steps we will begin to take when the final bill becomes law to ensure that everyone, everywhere, receives all of the necessary health care services to enable them to be well and to lead productive lives at their fullest potential. At the very least, I would like to see that we provide some language that as these savings are realized, at least a portion of them will be used to provide some of the services that will still be left out at the end of this process, including bringing the territories to parity in Medicaid. I have several amendments I will offer. I look forward to working with you, Madam Chairman, our ranking member, my colleagues, to work to have them included in the final product.
Gentlelady's time's expired.